Hello, good evening. I'm Mary Wood from the Wisconsin Parkinson Association. Our mission is to provide hope, support, community, and resources for people with Parkinson's and their loved ones. Tonight, we have Casey Mathews, a physical therapist from SSM Health, Dean Medical Group in Janesville, and she's going to be talking to you about falls prevention. So welcome, and Casey, you're up.
Hi, my name is Casey Mathews. I'll be presenting today. If you could please put any of your questions in the chat box and we will address them at the end of the presentation. So falls prevention is a topic that I am super passionate about because it affects everybody. And it is National Falls Prevention Month. We're right at the tail end of it. So this is perfect timing for this presentation. So I got my background in this because I am board certified in geriatrics. And so falls are obviously a big topic with that. And I work with a lot of our geriatric population here in our geriatrics and pediatric Parkinson's patients here in Janesville at SSM. So why are falls important? So more than a quarter of all people over the age of 65 fall every year. That is a lot of people. And it is also the leading cause of injuries, both fatal and non-fatal among older adults. Over 800,000 people are hospitalized a year due to injuries from falls. And that tends to be head injuries and hip fractures, which are never good things. And they have noted that in like 10 years, so until 2016, the fall death rates went up 30%, which is pretty drastic. And they're predicting by 2030, there will be at least 7 deadly falls an hour. So not great, it could happen to anyone, and there are a lot of factors that lead into this. So with Parkinson's in specific, there are more risk factors. So the literature most recently is showing that 38 to 87% of patients with Parkinson's will experience at least one fall. Once you have one fall, you are more likely to have more falls. And they estimate that people with Parkinson's fall 2 times more than the general population. So we will go through the risk factors here, but over to the right side of the screen, you see kind of the typical presentation of Parkinson's, which most of you may be aware of from your own personal experience or experience of family members. So bradykinesia is what we call that slowed movement. Everything's just kind of slower. So when you walk, we should be taking kind of good heel to toe progression, but we notice with a lot of people with Parkinson's, you have that short shuffling gait pattern. And that alone puts you at more of a risk for falling. The reflexes are also kind of slow. We notice people have issues with starting and stopping their movements. There is also a lot of rigidity. And with that, with the rigidity comes that forward flexed posture. So if you look at our person right here, their trunk is leaning forward, which means their center of mass and center of gravity is also going forward. So it's easier to fall forward because you're already going that direction. But also if someone nudges you backwards because they're so used to being in that forward position, it does not take very much to lose the balance backwards. And then freezing is another really big thing. So freezing is when those, you're walking and you kind of just get stuck, and sometimes the body will just go ahead of the feet. So again, puts you at greater risk for falling. the fact that a lot of people on Parkinson's are on the carbidopa-levodopa actually puts you at risk for falling as well. So that is one of the medications that increases risk for falling. A lot of medications do. And that's not to say that those people shouldn't be taking the medication. We definitely want people taking their medication for Parkinson's because it helps so much more, but it does increase the risk. So that's something we have to kind of be aware of in the back of our mind. We also can get what's called orthostatic hypotension. So a lot of people have the diagnosis of hypertension or high blood pressure, but you can also get, in addition to that, orthostatic hypotension at the same time. So orthostatic hypotension is a blood volume type thing. So it is a drop in blood pressure from different positions. So most often people get it from laying down to sitting or from sitting to standing. And typically it's just kind of that feeling of being really lightheaded. It'll occur a little bit after the fact. So if you ever get up really quickly and kind of feel that head rush, it's all of that blood pooling down to your feet. So if you don't get enough water throughout the day, eating too much salt, this is a side effect of like all of the medications that are out there pretty much. So this is a risk factor in a lot of people, and people with Parkinson's are more likely to have this condition as well. And then another thing is constipation. So this is not something most people think about as being a fall risk, but with constipation, often when people are on the toilet, they'll kind of strain. We call that the Valsalva maneuver. But when you strain and you do that Valsalva, you end up holding your breath, which can cause those changes in blood pressure, causing you to pass out and falling off the toilet, which is, again, never the best thing to happen. People with constipation, when they do have to go, they may also kind of rush to the bathroom because they have to go, and rushing puts people at risk for falling as well. So those are the factors we have to kind of look into. So how do you know you're at risk for falls? How do you identify this? So 3 questions you can ask yourself. These are nice and simple. Have you fallen in the past year? No falls are normal. It does not matter what your age is. It does not matter what your diagnosis is. You should not be falling. And you should not be worried about falling. If you do worry about falling, definitely we need to do something to address this, because being afraid of falling causes you to change what you're doing. You'll either limit your activity or change how you're doing things. And our body kind of tries to take the easiest way to do things. It compensates, and it doesn't always compensate in the smartest ways. So that can put you at increased risk for falling. And then, do you feel unsteady? Never a great thing, because again, you might end up modifying what you're doing or restrict your activity, which is not great. So those are 3 easy questions you can ask yourself. If you do answer yes to even one of those, definitely talk to your doctor, talk to your medical practitioners, see if you can do something about this. So other considerations, as I just mentioned, a lot of people kind of modify or avoid activities. When we avoid activities, we end up sitting more. When we end up sitting, we lose muscle mass, and then we start to not be able to do normal daily tasks like getting out of a chair, cooking, cleaning, getting off the toilet, getting out of bed, things like that. Number of medications taken. So this is a really, really big one. So a lot of people are on a lot of medications, particularly if you have a lot of like comorbidities or other things going on besides Parkinson's. And if you have multiple providers who are prescribing medication, which is often the case. If you have a neurologist, cardiologist, pulmonologist, your primary, psychiatrist, the list can go on. And if they're not all in the same system, it can be really easy for them to kind of prescribe a medication to treat a side effect of another medication. And what can happen is you can get a list of, I've seen patients with over 30 medications. And as I said before, one of the side effects of being on these medications is orthostatic hypotension. Dizziness is one of them, and falling is another one of them. So we really want to make sure you're taking the appropriate amount of medications. If you need to take all those medications, you need to take all of those medications. But we want to make sure there are no overlapping things. You're not treating the same diagnosis with multiple medications when you don't need to be. We want to make sure everyone's on the same page with your medications. Mental health also plays a big role. If people are depressed, they're not doing as much, they're laying in bed. Again, when we decrease our activity, we become more deconditioned, which then increases our risk of falling. Same goes with activity levels. So the more active you are, the better off you are. Cognition can also play a role in this. People with dementia, Alzheimer's, or what we call a mild cognitive impairment, which is not quite the point of having dementia, but it's like the start of it. They're all kind of at risk for increased falls. So we kind of want to be screening, are there any memory changes? Vision is a big one, and hearing are also like two of our really big ones. So we have three primary balance systems in our body. We have our vision, we have what we call our proprioception, or our joints' ability to know where we are in space. And then we have our inner ear, which doesn't quite go with hearing, but it's close. So if your vision isn't good, you're not going to be able to see obstacles ahead of you. You're not going to be able to see like the curbs or the edge of a stair or things like that. And so it's just really, really important to get that checked. Hearing, you might not be able to hear someone call out, let you know if there's an obstacle in the way. It's good to have checked every year. And then sleeping. Sleep is always important. Sleep is how we heal our body. And then home safety, which I'm going to get into later. There are a lot of different things that go into that. So we have this cycle of falling. And so we have a fear of falling. We then do less activity. We get deconditioned. We increase our risk of falling. We fall. We then have more fear of falling. And then it's just a cycle. So we need to break that cycle and kind of stop that. So how do we prevent these falls? So hopefully no one's home looks like this. This is kind of all sorts of chaos. The first thing we want to have is proper lighting. Dark rooms are never good. I know most of us who have lived in our houses for a while can kind of feel your way in the middle of the night if you're going to the bathroom. Use night lights. They have these really cool LED strip lights that you can kind of line the hallways with the doors that a lot of people like. They've got the push buttons, the clap on, clap off. The options are kind of endless. You want to make sure your path is lit so you can see where you're going, see what you're doing. In addition to that, we want to have a clear path. We don't want it like this picture of the room right here. We want to just kind of reduce your tripping risk. On that, we want to tape down or remove the rugs. I understand people love their rugs. I lived with my grandmother when I was in grad school, and I would take that dang rug and I would hide it in the basement because she didn't do stairs very well. And every day I came home, I'd find a brand new rug right in the same place. So if you can't get rid of your rugs, tape them down. That way the corners at least don't come up. You're at less of a risk for tripping for them. Most PTs will probably want you to get rid of your rugs, but you do what you got to do. And in that line, we want to move or tape down our cords. Loose cords are never good because they're always kind of moving. You don't know where to expect them. So if you can kind of tape them, particularly along the wall, they've also got devices where you can kind of bundle the cords and attach them to the wall. Those can be really useful. Handrails are great too. So a lot of people aren't super steady on stairs. There is no shame in using your handrails. We want you to be as safe as possible. Handrails are a lot more supportive than just reaching out against the walls. It's better than not using anything, but it's not our best option. It's not going to be able to kind of catch you if you start to fall. And in that line, grab bars are great. Preferably the ones built in, because the suction ones, particularly in showers, can kind of pop off. But if you're in a rental apartment and that's all you got, it's better than nothing. And they do have some that kind of clamp onto the bathtub and raise up. And those can be really, really helpful too. Grab bars may be one of PT's favorite things. So adaptive equipment, grab bars kind of fall into this, but shower benches and chairs are great. Again, there's no shame in sitting for showers. It's really hard. There's slippery surfaces. Again, so if you have a bath mat, that is great. But shower benches and chairs are wonderful as well, particularly if you can't stand unsupported for a long time. There are a lot of balance challenges when you're in the shower. So if you're washing your hair and trying to rinse, people will often close their eyes so they don't get soap and water in there. If you're on a slippery surface with your eyes closed, that is dangerous for anyone. It doesn't really matter what age. My kiddo has slipped in the bathtub. I've slipped in the bathtub. It really doesn't matter. So do what you can to be safe in the shower. Grabbers are great. My husband's grandfather used to use his grabber for just about everything. He would move the cord while my mother-in-law was vacuuming. They're great for getting things off the floor. They're just wonderful to have in general. And a lot of people, again, are really unsteady when they're bending forward. So grabbers are good for that. Sock aids and shoe horns often are not utilized as often as they should be. So sock aids help you get your sock on. You basically put the sock around it, slide it up your foot. The shoe horns, you just slip on your shoes a little bit more easily. Again, prevents that bending. A lot of people just have a hard time getting those on. And they have special ones, sock aids now for compression socks as well, which is absolutely great. Bed rails are also really, really effective. A lot of people have issues with rolling, particularly with Parkinson's, because you lose that rotational movement. So rolling in bed can be really difficult. So a lot of my patients like the bed rails in this picture here. It just slides under the mattress and it just gives you something to hang on to. You can remove it at any time. It's easy to make the bed around it. So those are another great option. I feel like I've said that about everything. And then my other really good thing is car door handles. So these are little handles that you kind of just pop into that little loop in the door, and it gives you a handle to help you kind of boost up, because cars can be really short, and the shorter the surface, the harder it is to get off. So these can be good options to help your stability. 10 footwear. Let's talk about this, but basically we want to make sure that you're wearing properly fitting shoes. So nothing too big. This is often something we'll see, particularly if you have a lot of swelling in the legs. People will get big shoes because they know their feet will fit. When you wear a big shoe, you're more likely to trip because your feet are going to kind of slide around in that shoe. So make sure it fits well. We want to avoid an elevated heel height. So high heels are never, they're not great for most people, but particularly with Parkinson's, when you're elevated, it kind of sends your body forward. And with people with Parkinson's, your body's already going forward. So it does not take much to go over forward. And then in the home, slippers and grippy socks are great. A lot of floors can be slippery, particularly if you have hardwood, laminate, tile. Carpet is a little less important. But again, if you have anything like neuropathy in your feet or diabetes, you want to definitely be careful, just because things can get stuck in your foot. You can get splinters and things that can get infected and maybe not know about it. You also may not know where your feet are. And so this kind of helps you maintain your grip so you're not sliding around your house. Okay, so incontinence and constipation. Please don't strain. I think I covered that. So there is a proper way to position yourself on the toilet, and that is to kind of have your feet propped up. So I don't know how many of you know about the squatty potty, but they're absolutely wonderful. Our pelvic floor PTs cannot say enough about them, and we have one at our house, and I swear our family does not want to go anywhere without it. So if you properly position yourself on the toilet, the muscles surrounding that area kind of relax and allow it to come out easier, which is great for people with constipation. For incontinence issues, if you're finding yourself like really rushing to the bathroom or you're leaking, schedule times to go to the bathroom every few hours. We don't want to go super often, because that will actually train your bladder that you have to go to the bathroom that often. But scheduling time to the toilet will kind of prevent those accidents. It will make sure you're not rushing because you've given yourself time to get there. If you notice issues with having to get up a lot at night, you want to limit drinking your fluids about 2 hours before bedtime, and that will prevent that, hopefully. Then we want to avoid irritants. That tends to be spicy food, carbonated drinks, caffeine. That really all gets the bladder going, will make you feel like you need to go to the bathroom and need to go to the bathroom now. So I know caffeine is a great thing. We all love it, but limit it if it's really starting to irritate your bladder and you're noticing you're going to the bathroom a lot. And then again, make sure you're utilizing night lights in the middle of the night. If you're rushing and you're rushing in the dark, that just is a really, really bad situation to put yourself in. So this is an example of a squatty potty here. Apparently they are all sorts of fancy now, so you can get the kind that fold up. You can get ones that match your decor. It really, we can't say enough great things about them in PT. So sleeping. Sleeping is a tricky thing. So the research is coming out showing we want to sleep enough, but we don't want to sleep too much. So the most recent Balance and Fall certification I went to recommended at least 6 hours a night of sleep. But we want to avoid excessive sleeping. So sleeping all day, sleeping at weird hours. So naps are okay, but we kind of want to limit the length of the nap. If you nap for too long, too late in the day, that will confuse your body. Your body may think it's the next day. It can cause a lot of memory issues. So we want to kind of have proper sleep hygiene. So, and that goes with the wind down routine too. So we want to kind of keep the bedroom for sleeping. And then kind of turning off all electronics before bed, doing some sort of calming activity, whether that's reading, journaling, drinking tea, kind of whatever is calming for you. Try to shut your mind off. It'll make it a lot easier to go to sleep. And try to have a consistent bedtime. Your body will kind of pick up on those cues, and that will help. Because as I said before, sleep is when our body heals ourselves. So particularly with exercise, it's important because we need to heal those muscles. The medical management, I think I covered this before. Basically, just make sure you're having your medications checked, you're having your hearing examination, and you're having your vision checked regularly. This is typically something you want to do at least once a year. And then we live in Wisconsin, so we cannot not talk about winter specific tips. So it is the end of September. It's starting to get cold at night. We're going to be seeing snow probably sooner rather than later, and we will definitely be seeing ice sooner rather than later. So my two big tips. One is a tip for your cane. So these are little spikes that you can attach to the cane. They have ones that flip up and flip down so they don't damage your floors. But basically, it's going to give you traction if you use a cane, and provide you with more stability. And then we also have yak tracks, which is something that I will often use myself, just because even as a balance and falls PT, I still slip and fall on the ice. It's just tricky. It, again, doesn't matter your age, doesn't matter your diagnosis. But yak tracks or other similar ones just kind of slip around your shoe. They have ones with spikes, but I prefer these ones with coils that are on my screen here. And they prevent you from slipping and sliding around as much. And then the other thing that we always talk about is try to walk like a penguin. So with Parkinson's, you often walk with your feet really, really close together without often even realizing it. You want to widen your base of support. So widen those feet nice and wide, and you almost kind of want to waddle side to side, but you don't want to take too short of steps. Too short of steps can put you at more risk. So we want to take kind of slightly smaller, but still pretty decent sized steps. Going forward, taking your time. Winter is not a time to rush. But winter is also not a time we just want you sitting at home. Because again, we've talked about that physical inactivity. And spring and summertime are really, really when caseloads pick up in physical therapy, because people have either A, slipped on the ice and fractured something, or are just injured in general, or B, they've become so inactive over the winter that they're now having difficulty doing their daily activities. And that is never something we want to see. So that brings me to exercise. So the CDC guidelines, we want about 150 minutes of exercise a week. And then on top of that, 2 days of strengthening and flexibility exercises. And I know that sounds like a lot, but it breaks down to about 5 30-minute workouts a week. And any exercise is better than no exercise. So specifics, if we want to improve our balance, we're looking at getting 52 hours over a 3 to 6 month time frame. That is not a lot. I calculated it out. It's like 2.5 hours of exercise a week. It's manageable. So within that, we do balance, core, lower body strength, and then walking with balance challenges. And balance challenges don't have to be anything difficult. It can just be turning your head, looking up and down, turning to look because someone called over you, talking and walking at the same time, things like that. So the 3 to 6 month time frame, it takes a while for these things to happen. I wish I had a magic wand. I could just help my patients with their balance. But the truth of the matter is, it takes our muscles a long time to gain strength. It takes a long time for our brains to kind of relearn connections. It's efficient, but only so efficient. However, research is great. It's showing that 30 minutes of light activity leads to a 15% decline in falls. That is amazing. And then 1 minute, just 1 minute of moderate to vigorous exercise can lead to a 40% decline in falls. That's kind of unheard of. So I know a lot of people don't like exercise. I, as a PT, don't always like exercise, but it is super, super, super helpful in preventing your risk of falls and helping your balance. So again, anything is better than nothing. Light activity will help you. Moderate to vigorous, you really got to get that heart pumping, have a little bit of difficulty talking. And if you can't do that, that's okay. Again, anything is better than nothing. So getting up from a fall. I'm going to pull up some pictures on the next slide, and then I also have a video of it, which is hopefully still up. So this is the tricky component. These pictures on the screen are the ideal way to get up off the floor. There is not one right way for everybody, particularly with Parkinson's, with the rigidity, with a lot of people don't have good motion in some of their joints, or they have orthopedic concerns, like their knees really hurt and they can't kneel on them. They have shoulder issues, they can't pull up on themselves. You do what you got to do to get up safely. So in the ideal world, if you start on your back, you want to roll onto your side and kind of push your upper body on off the floor so that you're on your hands and knees. If you can do that, crawl over to a chair. There is no shame in using what you have around you. Then we want to place our hands on the chair, bring one knee up so your foot is flat on the ground, and then push up from the floor. If you don't need a chair, kind of just push up on your knee. That is amazing. I don't see a lot of my patients who are able to do that. So again, that's the ideal way. I have it on good sources that if you have to call 911 to pick them up off the ground, that's not a bad thing. They don't have to necessarily take you to the hospital. You always have the right to refuse if you're feeling okay. So if you have hit your hip, your head, you're having a lot of neck pain, please go get checked. We actually had a patient the other day who hit his head and didn't realize that he had fractured his neck. So we had to send him up to go get imaging. So particularly if you hit your head, even if you don't think you have a concussion, please just go get checked. So get up off the floor, however safe, but if your family member, if you can't get up off the floor and your family members don't feel safe doing that or helping you, please call for help. That's never a bad option. So then community resources. So these are ways we can kind of look for other outside help. So we have a lot of balance and falls programming here. So first place I would start is looking up evidence-based programs. So some examples of this are Stepping On, Strong Bodies, but there are a ton of others that are listed. The Wisconsin Institute for Healthy Aging actually has a website where you can find a workshop. So it's all of the different evidence-based courses in Wisconsin, and it will let you know when they're running, if there's virtual options, where they're located, things like that. So Stepping On is one of the programs that I actually helped teach in Janesville. So it is a 7-week course, I believe. and you learn some basic exercises. You learn about home safety. There are some lectures. I think they meet 2 hours a week. And it's a good starting point if you feel like you're at risk for falling. Strong Bodies is not technically evidence-based per specific guidelines, but there is a lot of evidence behind it. So this is a program that kind of started in Wisconsin as well. This is a group that meets about 2 to 3 times a week for 12 weeks. There's normally a little bit of a nominal cost. I think near us, they recommend a $25 or $30 donation for all of those sessions, all in one. So it ends up being $1 or $2 each session, which is not bad at all. But again, they work on full body strengthening. They work on flexibility. They work on balance. So another really, really great option. But there are other things you can look at too. Senior centers are a great, great resource. YMCAs. Silver Sneakers is offered at a lot of different places. If you want something more focused, it's not necessarily for the geriatric population or the older population, but it can be good for just low intensity exercises as well. And a lot of insurances will actually pay for the Silver Sneakers membership, and you can get into gyms all over the US for no cost with this membership. So that is something to definitely look into. Tai Chi is a great, great thing. It's been wonderful for my patients with Parkinson's because it really works on that weight shifting, slow movements, really controlling the movements. So it's a great option. Again, really low impact, easy on the joints. So something good to look into. And then Parkinson specific programming. There is a ton of it out there. In our area, we have Rock Steady Boxing, but I know there are a bunch of other classes available. And any of those are going to get you moving, work on your balance, work on those issues most people with Parkinson's have. So a lot of getting that trunk rotation back, helping the posture, helping with the shuffling. So again, look into those. I'm sure you guys have heard of quite a few, but if you just type in Parkinson's classes near me, you'll find a ton. You need further help, get PT. Of course, I'm going to talk about PT because I am a PT. So physical therapy can work on so many different things. So we have the LSVT BIG program, which a lot of people know about, and that is a great option. There's also the PWR moves, and that is a little bit more individualized, but is very similar to LSVT, where there are specific movements, but again, a little bit more individualized to the participant. The individualized programs are really great too. It's always best to find a physical therapist with some experience in Parkinson's. You want them to understand kind of what you're going through. But there are a bunch of things that physical therapists can treat that people don't know about. So we have a pelvic floor therapist that can help with incontinence. I refer people to them all the time. We shouldn't be leaking. We shouldn't be really rushing to the bathroom. If you're having issues with that, it might be worth just an initial consult to see if there's something they can do. If anything, they can give you tips. It's not just Kegels. There's a lot that goes into it, and I'm not a pelvic floor therapist, so I'm not the best person to speak about this, but a lot of my patients have had a ton of benefit from this. We can work on balance, we can work on strengthening. Those are things people typically know about. But we also treat things like dizziness. So that is actually one of the things I see most often in our clinic. As we get older, our inner ears, the balance system in our inner ears doesn't work as well. So we will give you some crazy exercises to kind of teach it to work better. And oftentimes with balance issues, the inner ear again plays a big role. So physical therapy is a great option, and most neurologists and primary practitioners are 100% willing to give referrals for physical therapy. And then check-in visits. I love doing check-in visits with my patients. So I just discharged one of my patients who has Parkinson's, I think it was yesterday. And we just went ahead and we scheduled a visit 6 months out right away. I know I'm going to be able to get a referral. And I could tell she was a little bit hesitant about being discharged, even though she was doing great. So what we're going to do, we're going to follow up in 6 months and reassess all the same outcome measures that I tested yesterday. And we're going to see, has she declined at all? Parkinson's is a progressive disorder, so check-in visits are a great way to kind of maintain continuity of care. There are often little declines that your physical therapist might see before you see, or vice versa. And as I told her, she can always see me before then, but I'd like to just check in, know how my patients are doing. I would much rather catch something when there's a little bit of decline before there's a major decline. It's so much easier to work on preventative care, but unfortunately, that's not where our insurance system is at this point.
We can wrap it up here. So thank you so much, Casey. It was great information and a great way to tie up Fall Prevention Month. Thank you so much.